appear to be self-medicating more during the pandemic with increased alcohol and cannabis use and sales.
So is it a matter of being stuck at home with more time on your hands or something to be worried about? CTV's Ryan McDonald looked into that for us today. Ryan.
Jason and Maria, back when the lockdown first started in March and April of last year, you might recall we quickly started hearing about people getting home deliveries of their favorite drinks. The idea being that having one or two could be a way to de-stress or feel normal during this pandemic. Well, now some new numbers are in that appear to show that our COVID-19 consumption rates have in fact gone up. It's long been a way to toast good times and deal with more difficult ones. But new numbers suggest that for Canadians during this pandemic, it's a coping mechanism that may have become a problem.
We've got stress and uncertainty and anxiety and depression all around.
Now, a study by the Canadian Institute for Health Information shows that 1 in 4 Canadians reported drinking heavily at least once a month. The survey took place between March and June 2020, the height of our COVID-19 lockdown.
It would be surprising if people weren't drinking more because one of the predictors for drinking is the amount of idle time we have.
Dr. Chris Milburn is the emergency room lead for the Nova Scotia Health Authority's Eastern Zone. He says while he hasn't noticed any sort of spike in traffic at the ER caused by alcohol-related incidents, he's still not surprised by the numbers.
The pandemic has come, it's put a lot of people out of work, it's made them idle, sitting at home with more time on their hands, no reason to get up at 7 o'clock the next morning, so why not have that extra drink or 2 or 3, right?
Many Canadians have been drinking more throughout the course of the pandemic.
That's why the Canadian Cancer Society is back this year with its Dry February campaign. According to a survey they've done, 1/3 of participants are drinking more since the pandemic began.
We know that about 1/3 of Canadians are not aware of the relationship between alcohol and cancer, and so a huge goal of this campaign is that education and awareness raising.
Dr. Simon Sherry is a clinical psychologist based in Halifax. He says whether it's alcohol or any other substance, there are warning signs to watch out for.
Problems with employers, problems with a spouse, problems with the law. And what you see, whether it's cannabis, alcohol, or another substance, is the pursuit of that substance, the use of that substance, and then recovery from that substance starts to be a dominant and an organizing theme in the person's life.
The Canadian Institute for Health Information study also shows a spike in cannabis use. For those looking to change their habits, the doctors have some advice.
Pandemic's here, we have lots of idle time. It's a great time to try out some new healthy recipes, to get out for that walk.
There's certainly other more constructive and health-promoting ways you can deal.
Another societal challenge brought on by a pandemic that's had us looking inward from the beginning. Then there are the numbers from the Nova Scotia Liquor Corporation. In its first financial quarter, which was between April 1st and June 28th, 2020, sales went up an unprecedented 5.3%, followed by an even bigger jump, another 6.3% during its second quarter, which was between late June and late September. Now, the corporation points out that the data is, of course, impacted quite a bit by the fact people weren't able to get out and have a drink at bars and restaurants as much as they normally would during those times, but those are still pretty big numbers. Jason and Maria?